Good morning, my little nerds. I am Dr. Shereene Idriss, and welcome to my YouTube channel. If you have not subscribed to this channel, I don't really know what you're doing. You better subscribe, follow, and like along. And if you haven't subscribed to my newsletter yet, please head over to pillowtalkderm.com and subscribe to my newsletter because we have a giveaway coming up, and it's an exciting one for only those who are part of the newsletter community. Now, normally I do this from bed or from my office. I'm from my bedroom or my office, but I'm currently in my bathroom. And why? Because it is midnight. My whole family is asleep. And if I go to the living room, I will wake everybody up. And this bathroom seems to have the best lighting in this apartment. So I am hanging out in my bathroom with all of you. What are we discussing today? Today we will be discussing everything droopy eyelids because this is a subject that is near and dear to my heart. Last year, I was recording a reel where I was doing a vascular laser demonstration. And in that video, I noticed through your comments in my DMs that something was up with my right eyelid. And when you guys started messaging me, you really made me notice it more and more that something was up with it. And at first people thought, did you get bad Botox? Did you do a treatment that caused you to get an eyelid droop? Fast forward, it was none of that because I had not had Botox. I had not done any sort of laser treatment that can affect my nerves in my face. I have what is known as an aponeurotic ptosis, meaning I have a detached and weakened muscle in my right eyelid, which I will get to in a second. But before we get into the meat of all of this, let's talk about you. So what causes droopy eyelids? So droopy eyelids can be due to many different things. And when you're looking at the eyes of a person, it's not just the lid, but also the brow. As we get wiser in life, things shift. Our volume tends to shrink and drop. But most importantly, our bone structure, our orbital rim, tends to get thinner and wider as we get wiser. And when the structure thins out and widens out, what happens to the fat sitting on top of that? What happens to the muscle sitting on top of that and the skin? It tends to kind of get displaced because the fat, in addition, is shrinking and dropping. So you're gonna get fat bags. You're going to develop them even on the inner corner of your eye. Your muscle gets weaker over time and your skin becomes more lax, and we develop redundant skin on our upper eyelids. So all of that happens with wisdom and with the aging process. Do they go hand in hand? TBD. But definitely death and taxes and droopy eyelids are for sure happening in our lifetime. It's definitely both a collagen issue as well as a facial restructuring issue, but also medical conditions can also play a part in this. What kind of medical conditions? There are rare conditions that can affect your muscle in your eyelid, especially if your body starts fighting chemical signals in your body. One of them is known as ocular myasthenia gravis, which is an autoimmune condition in which your body's immune system interferes with the muscle receptors of your eye, the acetylcholine receptors, and these receptors can't work very, very well. And so the muscle gets weak and you can get a dropped eyelid, a single dropped eyelid known as a ptosis, P-T-O-S-I-S. Another condition that you can develop is something known as aponeurotic ptosis. Now, this one is the most common type of acquired ptosis that you're going to get. And it's usually due to age-related changes. It's usually due to chronic rubbing from allergies, or in my case, long-term contact lens use. I've been wearing contact lenses since I was probably 11 years old because I am blind as a bat. And I also have the worst allergies in the world. I take Allegra every single day. And so I have been rough on my eyes throughout my lifetime. Now, not everything though is a medical condition. Some people, from the time they are born with naturally hooded eyelids. And I like to refer to that type of eyelid as a bedroom eye. It's a very sensual, seductive look that people have from a young age. So why should we really care about hooded eyelids if some people naturally have them, or if we're all going to develop them at some point in life? The reason why you worry about them is because the reality is, as this drops and as this comes down and as we get heavier, our peripheral vision can get impacted. And if that gets impacted, think about driving on a highway. It can be dangerous. So small tip for you, and this is a life tip, if you feel like your eyelids are getting hooded and heavier, go see an ophthalmologist. Let them measure your peripheral vision because insurance may cover a procedure for you. Now, this takes me into the treatment. What kind of procedures can we do for hooded eyelids? And what kind of procedures is insurance actually going to cover? So the one treatment that insurance will probably cover if you actually, I was going to say comply, but apply, is surgery. It sounds scary, and it is scary because your eyes are the door to your soul. Once your eyes switch and change, your whole look changes, and it can really change your overall persona. So I understand eye surgery being probably, in my opinion, one of the scariest surgeries that you have to decide if you want or not, especially if your vision is being affected. But what can people do, or what can people expect when they're getting eye surgery? First of all, it's called a blepharoplasty, when they cut the upper lid skin, all that excess skin that's there, and tighten it in order to lift and pick up your eyelid. They can also do this underneath your eye, especially if you have bulging fat pads, and take those fat pads out, tack your muscle up onto your bone, and really smoothen any kind of excess skin by cutting it out. Those are probably the biggest types of surgeries that you would consider getting if you have extremely hooded eyelids or heavy skin around your eyelids. But it's not to be mistaken for a brow lift, because a brow lift can also work wonders in the right face. Now, if you're somebody who naturally has high brows, I'm not going to tell you to go get a brow lift because you'll look even higher than you need to look. But if your brows are getting heavier and flatter as you get older, getting a brow lift might open your face just enough to give you a more youthful appearance without necessarily having to cut the excess skin around your eyes. But again, this is really something that has to be determined between an oculoplastic surgeon or a plastic surgeon and yourself. And this is where aesthetics and your aesthetic judgment has a huge say in the actual treatment. So it's not just medical care, seeing a medical trained physician, but really looking at the doctor as a whole and making sure that your aesthetic vision lines up. Now, the biggest risk with any blepharoplasty is overcorrection. Over opening the eyes, where all of a sudden you're like this. And especially if you have a very light ptosis, like in my case, my right eyelid is slightly dropped. If I were to do this surgically, I would be worried that this eye now opens way too much compared to the other eye. So unevenness is probably one of the biggest complications. You can also get dropped eyelid unwantedly if you over tighten, or if you're not the right candidate. You can also get what's known as lag ophthalmos, and an inability to actually close your eye fully. And I can say the most common thing that you should expect is swelling and bruising and itching, especially in the first few weeks as the stitches are healing and you're overall healing from this surgery. It does take 6 months to fully settle, and I tell my patients, do not judge an eye surgery until 6 months in, because most people who have hooded eyelids are used to doing this, right? To try to pick up the weight off of their eyes. Now, let's say we open their eyes with surgery, and they're still trying to do this because they're so used to doing that. It takes a minute for your body and lifestyle and your behaviors to get used to what's happening. But surgery has a 10-year lifespan, and it's one that you're probably going to have to repeat. So I want you guys to think of surgery as not a one-hit wonder that's going to fix you forever, but as something that you might need to repeat in 10 years. And I say this because if you're someone who has really hooded eyelids, or naturally hooded eyelids that get hoodier as you get older, it's probably best to do surgery before you fully need it. And I advocate this procedure as one that you do slightly on the earlier side, because you do not want to get a drastic change. You don't want to go from being like this to being like this and looking like a different human. You want to go from being like this to being like this, right? You want to have, I don't know if I just did like the Tyra Banks smizing situation. I can't see myself, I'm looking at the camera, but you know what I'm saying. So it's one of those things that you need to do before you fully need it. Now, let's say you're just not ready for surgery. You want to do everything minimally invasive. Then you come to this girl, okay? A cosmetic dermatologist who fully specializes in minimally invasive procedures, starting with injectables, Botox. People think you're gonna get like a crazy lift with Botox. The reality is you're lifting the brow ever so slightly with Botox. You can manage to open the lateral edges of your eyes, and you can manage to pick up a little bit the arch of your eyebrow with Botox, but you're never gonna pick up a heavy hooded lid with Botox. It's not gonna happen. The opposite can potentially happen as a risk, where you get an eyelid droop and the ptosis situation I was talking about earlier. The results last approximately 4 months, 5 months if you're lucky, and you do have to repeat them. So it's a very nice temporary option if it works for you. Fillers is another option because as we get older, we lose volume in our temples and the lateral parts of our face. So putting filler in our temple area can pick up the tail part of our brow, allowing this part to lift and raise slightly. Some people like to put fillers over here. I do not subscribe, especially if you have a hooded lid, because you already have weight on your eye and you don't necessarily need more. I think putting fillers alongside the brow bone is not a bad idea if you're very hollow as you get older around your eyes, but you would not be watching this video, I do not think, because we're talking about droopy eyelids and heavy hooded eyelids in this video. If you do not want to have anything injectable, there are devices on the market that I really do love, and these are heat-based devices. Ultrasound energy heat and radio frequency heat. Althera is ultrasound, Morpheus, Thermage, Secret RF, Vivace are all radio frequency. And these heat-based devices allow you to tighten and tighten the skin and to contract the muscles. I have been doing Althera since 2013 or 14. You guys can see the distance between my lid and my lid fold has opened dramatically since 10 years ago. Additionally, and I'm going to zoom back out, I do it along my jawline too. This is not a jawline video, but there's definitely more definition. And I do it outside of my brow bones, and it has lifted my eyebrows over the course of the past 10 years. I have repeated the procedure every 1.5 to 2 years as a very light kind of tightening treatment that I get done along the course of time. But listen, if you go and Google Althera, you're going to see a lot of bad reviews. I do not know where people are getting treated by these trolls. I don't know what kind of devices they're using. I don't know if they're getting, black market devices. I don't know if people are not trained and they're doing it inadequately. Althera and ultrasound energy can definitely melt fat if it's overdone or done poorly, but so can radio frequency. And so this is why you need to go to somebody who is skilled and who knows what they're doing. I personally think it has helped my face and helped me minimize that hooding that I had 10 years ago that would have been worse today because I have my father's eyes. So it's definitely something that can really help in the long run when done correctly and consistently. But the reality is, when I first did it 10 years ago, I thought it sucked. I didn't see the difference right away. It takes 6 months for full effect, and I only noticed the difference in hindsight when I found those specific pictures on my phone. Now, if you do not want to go down that path, you can go down the laser path of resurfacing the superficial aspect of your skin, like an ablative CO2 laser that's going to burn the top part of your skin, allowing your skin to contract and tighten and basically retract slightly. But you're burning your skin, so there's a risk of post-inflammatory hyperpigmentation, there's a risk of scarring, there's a risk of developing milia, and the bigger issue I have with that is that you can't really do this all the time every single year or every 2 years. Because if you have too many of these procedures, and I've seen this firsthand, you start to look a little waxy. So I usually recommend this treatment during surgery when people are cutting and tightening to really have a smoothing effect overall, because it's not something that I recommend repeating on a very regular basis. And as well, it takes 6 months for full effect, so you can't just judge it completely right away. Thread lifts were one that were the hot topic in 2018, 2019, when everybody was trying to look like this. For whatever odd reason, they thought it was a good idea to try to look like that or to try to promote that for everyone, but it's not. And I've never been a fan of the thread lift around the eye because you're ultimately putting stitches underneath the surface of the skin. It's causing fibrosis and tightening underneath the surface of the skin. You might see an instant gratification lift, but that's going to go away and it's going to be replaced by scar tissue, which is going to offer a minimal lift over time. And if you do this consecutively over and over and over again, you're going to have a lot of scar tissue develop underneath the surface of your skin. And if one day you want to have a facelift or an eye lift or surgery, it's going to be much harder to have a controlled sort of medium to work with. So it's not something that I love. It's really, the improvement is minimal. You need a lot of threads and the long-term outcome of it is not great. This is actually probably the most important part of this video right now. When you're looking to do any sort of procedure like this, and I already hit on this with the surgery, you have to make sure that you and the provider that you are seeing have the same vision for how your face is aging. Because if somebody tells you, do surgery for your eyelids at 35, they're not thinking of your life at 45, 55, 65 plus. How many times in your life are you going to need to have surgery to correct the problem that you're having? Because guess what? Your skin is going to get lax again and your bone structure is going to continuously change. If you go to somebody who says, get a brow lift, but not an upper lid blepharoplasty, what if you end up looking like this and your eyes are already high enough? You need to make sure that you guys are aligned on the same page. And so looking at people's pictures, understanding their vision, understanding their philosophy is huge and crucial when you're talking about aesthetics and your overall face and your eyes in general. So those are definitely things you need to know about. Now, in terms of, let's say you don't want to have surgery, let's say you don't want to go in office, is there anything that can be prescribed to you? I was prescribed something. So let's talk about me for a hot second. When I realized my eyelid dropped, I basically prescribed myself iopidine. Iopidine is a medication which is an alpha adrenergic agonist that basically triggers your mular muscle, the muscle of your eye that picks up your eyelid, to contract and tighten. People prescribe this all the time if you have an eyelid droop from Botox. But I will say it's not one you can use long term. Iopidine's a little nasty bitch. Iopidine is a little nasty little biatch of a medication that can cause irritations and itching in the long run. And so you really have to be careful when you use it because your skin is probably going to get irritated, and mine did. So last September, I went to a neuro-ophthalmologist, and it was funny. I was at the neuro-ophthalmologist on the day that I launched Pillow Talk Derm with my eye in a patch trying to study my muscles of my eye. And he looked at me and he said, your eye looks extremely irritated. I think you have to quit the iopidine. And I was like, oh shit, so now what? I need to have surgery? He's like, no, you can try. And this is not in any way, shape, or form a commercial. I have no financial interest. Upneeq, which is oxymetazoline, which is basically Afrin nasal spray. And I saw another trending viral TikTok where the pharmacist is like, put Afrin in your eye cream, you're gonna get tightening of your eyelid. It doesn't work that way. Please do not do that. It's absolutely a waste of your time, money, effort, and energy. Just get the prescription because it's a different percentage, it's a different vehicle, and you need to put it in your eye so that it can be absorbed by the mucosa lining your inner eyelid in order to contract your muscle. So I've been using this with really good results so far. My plan is to use this until it stops working, and once it stops working, I'll consider surgery. I don't want to have to do surgery right now if I do not need to. Other at-home devices that you could potentially try if you do not have necessarily a ptosis but hooded eyelids, you can try the NuFace device, you can try the Zip device, you can try the tripolar device, that Tripolar Vantage I think it's called. All of those kind of are similar variations of a theme using microcurrent. I think the tripolar has more of a radio frequency effect, if I'm not mistaken. And are they gonna work? They're only gonna work as long as you use them. It's like Cinderella, right? The second you stop, poof, you're gonna drop. But when you're using them, you're going to see an effect with the microcurrent kind of targeting your muscles, but not so much after that. And then people who love the jade rollers, quartz rollers, gua shas, etc., what you're really noticing from that is basically lymphatic fluid being moved around because it can pool around your eyes, causing the droopiness and the heaviness to appear like it is worsened or improved after you actually do a massage around your eyes and get that fluid moving. But it's not actually taking care of the root cause of the issue. So with that, I hope you guys enjoyed this video. Do not rub your eyelids. Take it from me. If you wear contact lenses, try to limit how many hours a day you're wearing them and be gentle on your eyes when you're putting them in and taking them out. And if you have allergies, please, I think you definitely have to treat them because I clearly wanted to rub my eyes during this video and I did not take my Allegra this morning. So I hope you guys learned a thing or two. Don't forget to subscribe. Don't forget to sign up for the newsletter. There is a fun giveaway happening this week-ish for all of those who are subscribed to the newsletter. And yeah, I love having you guys every Saturday morning on my channel. Let me know what you guys want to learn about next. And I have not forgotten the vitamin C video. It is coming up next week. Have a great weekend.